Every once in a while there's an interesting article. I found it in the Asbury Park Press. I think it was a reprint from USA Today. It was some common sense points. You can argue they were good or bad. How to handle a cold. First of all, how do you know you have a cold and differentiating that from something else?
Well, a cold, a respiratory tract infection, a viral infection, these are all different terms that we use for patients who have some common symptoms. The common symptoms include runny nose, congestion, maybe a little bit of a loose cough, low-grade fever to a maximum of approximately 101, maybe a little higher in children. But these symptoms come on slowly, cause discomfort, but really don't make you so sick that you can't function. Those are the common definitions of a cold.
Well, in the article, the first thing they talked about was to give a lot of fluids. That's pretty common sense, is that true?
No, absolutely. Fluids are very helpful. They keep the secretions and mucus nice and loose so it's easy to clear it, and it also helps combat fever.
In other words, if you have a little fever, you lose fluid and you get dry. So you can't maintain good fighting hygiene if you're also dry.
No, exactly. As fever causes you to become somewhat more dehydrated, you need more fluids in your system to balance out the scales, and it allows the bloodstream to function properly.
And they talk about natural germ fighters and things like that. Well, like breastfeeding. Well, there's some indication if you breastfeed, you get a little bit of immunity from breast milk. Is that true?
Well, certainly there are substances in breast milk that can help the body fight infections to some degree. To what extent breastfeeding can actually help us improve or prevent colds is certainly controversial, but breastfeeding is clearly better than not breastfeeding, given the choice of the two.
And washing of the hands, using some alcohol hand cleansers, of course, keeping out of the reach of children, is a wise idea. Is that true?
Absolutely. The most important thing that we do to prevent the spread of infections is washing your hands. Washing your hands with a good bacteriostatic soap or with the newer liquid cleansers that actually kill the bacteria as you rub the cleansers on your hand are the most effective way to prevent infections from spreading.
Well, you have to remember, it does contain alcohol, and a little baby can get near it, so be very careful not to have it loose and readily available that a little toddler can get their hands on that too. Is that true?
Yes, absolutely. Toddlers are notorious for getting into places that they shouldn't and putting everything in their mouths. So always put any type of cleanser or hand cleaner of that nature in an area where children cannot reach it.
We always recommend vaporization. There's cold and there's hot. What is better, cold or hot?
Probably doesn't make much of a difference. The advantage of vaporization is that it adds humidity to the air, and in the winter when the air is very dry, that dry air further dries out any secretions and mucus that the child has, making it more difficult to breathe, especially through the nose. So by adding some vapor to the air, it balances out the humidity so that the mucus doesn't dry out, and that works well to help prevent those secretions from getting too dry. The one thing to be careful about, though, is that vaporizers and humidifiers can also be places for molds and bacteria to grow. Water is a wonderful solvent for substances like bacteria and viruses to grow and then be spread through the environment. So if we're going to use a vaporizer or a humidifier, there are a couple of important rules. One, you need to fill it and turn it on immediately when you're ready to use it. Never let water stand in the vaporizer for a long period of time. Secondly, only have it on for 2 or 3 hours. You don't need the vaporizer on all night. 2 or 3 hours are sufficient to put enough humidity in the room to be comfortable. 3, at the next day, empty the water completely. Wash it with any type of cleanser that contains bleach, because bleach-containing cleansers are the types of substances that will kill molds and bacteria most effectively. Dry it thoroughly, and again, fill it only when you're ready to use it.
They talk about gravity, like elevation. Is that a good idea?
Elevating the head will prevent the mucus from accumulating in the throat, in the sinuses, really helps with drainage, and helping that drainage prevents secondary infections from settling in.
Saline nose drops, are they a good idea?
Saline nose drops are probably the easiest way to add humidity to the nose. So rather than put a vaporizer on to make the whole room wet, a couple of drops of saline into the nostrils of the baby will clear that mucus, let it flow easily so that the breathing is more comfortable.
They talk about suction and no suction with these bulbs. Is that good or bad in your opinion?
Suctioning is something that should only be done with a great deal of care, because when you suction in the nose with bulb syringe, you're applying pressure to the lining of the nose, and the lining of the nose, when you have an infection, is already very inflamed and damaged. So when you add more pressure to that area, you can actually further the damage and lead to more mucus and more irritation for the child.
In other words, caution.
So you would only do it with caution.
Tap and tilt. Is that a good idea?
Well, the idea of tapping and tilting, of putting the baby on their side and tapping on the back, helps clear mucus from the lungs if it's accumulating. It can be helpful in some settings, but you need to be very careful, because if you put the baby in uncomfortable positions, or if the baby is eating and it could very easily lead to vomiting, and that may actually worsen the problem rather than improve it. So again, do it with caution, and only if you've been instructed by a physician how to do it properly.
They discuss sucking on cough drops. That's a little controversial. Do they work? Do they don't work?
At this point, there's really no good clinical evidence that cough drops help improve cough. They give a little lubrication to the throat. It might make you feel a little bit better while you're sucking on them, but in terms of decreasing the severity of the cough or the length of time that the patient is coughing, there's no evidence that it really helps. The other thing that you need to be aware of is that cough drops can easily be swallowed down into the lungs, especially by younger children. And so we don't recommend any type of cough drop or cough lozenge on children less than 3, and actually we probably shouldn't use them on children less than 5 when they're sick, since when they're sick they can have a coughing episode, and that might lead to inhaling that cough drop in an unexpected time.
There's a little controversy. They discuss about medication safety. The Academy actually doesn't want cough syrups, I think now under 6. The FDA said under 2 because there were some medication errors. We're not sure if they work. Do you agree with those thoughts?
The FDA recommendation that that decongestants should never be used in children less than 2 is, I believe, a good recommendation. Under 2 years of age, we don't have good evidence as to how effective they are. We don't have good evidence about the metabolic clearance of these medications, and there have been episodes where children end up in the emergency room, end up hospitalized, and have serious side effects from the use of these decongestants and their side effects. In children 2 to 6, there is also a great deal of concern. At this stage, the cough decongestants should only be used with extreme caution and only under the direction of a physician in that 2 to 6 year old age range.
And the last one's very common sense. Get a flu shot. Get vaccinated. Is that true?
Vaccines are the most important tool we have as physicians to prevent infections. Vaccination against the flu, vaccination against a number of other viruses and bacteria that we can presently vaccinate against will always help. Even in a year such as this, where 40% of the influenza is not covered by the vaccine, there still has advantages in getting flu vaccine because it still decreases the severity of a flu infection, even if it doesn't absolutely prevent infection 100%.
So basically it's common sense. And if your kid is sick, don't send them to school to expose other kids to the illness. And if some parent wants to bring a kid that's sick to your child, you wouldn't want it. So don't reverse the process. Is that true?
Absolutely. Common sense should rule. We should turn the clock back to the way our parents treated us. Stay home from school, drink lots of fluids, chicken soup, orange juice, and just take good care of your body, and the rest will fall right into place.
And any child that hears this video would say, the doctor said I shouldn't go to school today. Is that true?
Absolutely. Doctor's orders.